Welcome, everyone. This is Group Dentistry Now's DSO Study Club. We have Dr. Karson Carpenter on. He is the president of Compliance Training Partners. We're going to let everybody file in, give you about 2 minutes, and then we'll get right to the presentation here. This is top OSHA and infection control violations in the dental office. So we're going to spend the next, probably 45 minutes. What do you think, Dr. Carpenter? And
That's
then we'll
about
get to
right.
some Q&A.
45 minutes. And then we'll answer some questions at the end.
All right. So just a couple of minutes for everybody to get into the webinar, and we'll get things going. We appreciate you being here, and we'll make sure we finish up at 3 p.m. Eastern. And there will be a slide at the end if you want to collect your CE credit. That slide at the end will tell you how to do that. Just another minute, we'll get things going. All right. Now 30 more seconds, we'll get things started. And if anybody has any questions throughout the webinar, just type your questions in the Q&A section there. We may not get to all of your questions. We had, oh boy, quite a few questions that came in ahead of time from people that registered for this webinar. A lot of great questions, and I think I have 4 pages in front of me here. So if we don't get to your question, we will, somebody from Dr. Carpenter's team will follow up with you for sure.
Yeah, we won't disappear on you. We've got a team that can answer those questions, Bill. Whether it's next week or next month, we'll be glad to help everybody on this webinar.
That sounds good. Okay, we are at 2:02 Eastern here. So I said 2 minutes, we're going to get things started. And I'm going to turn things over to Dr. Carpenter in 1 second. Again, this is the top OSHA and infection control violations in the dental office webinar. If you need a CE, you will get 1 CE credit. There is a slide at the end that tells you all about how to get that credit. And you should have received an OSHA compliance audit checklist and also a detailed infection control checklist that was emailed out yesterday. We'll show you what those look like. And if you didn't get access to those, we'll send a follow-up email with those as well. And I think Dr. Carpenter has something else planned that he's going to send out to you. But just an introduction, Dr. Karson Carpenter is the president of Compliance Training Partners, and Compliance Training Partners has been providing OSHA guidance for dental groups and dental practices for over 25 years. Compliance Training Partners has also been involved in OSHA inspections all over the United States. So going to be a really interesting conversation. I'm going to let Dr. Carpenter take over from here.
Very good. Thank you, Bill. And welcome, everybody. Thanks for taking some time out of your day to attend this. And let's see if we can, Bill, am I able to advance that now?
You should be. If not, I can give you a push here.
Yeah, it's, here we go. Now the arrow's visible. There we go. So we're going to go over top OSHA and infection control violations that we've seen at Compliance Training Partners over the last year. This is a very practical course. I practiced dentistry for many years, so I do know how to put an office into compliance. Just to give you a quick picture here, here's our office. Here's my wife, who's also a dentist, practiced together for many years. And we have an office probably much like your office. So I'm not going to quote rules and regulations. I'm a pretty practical guy. First of all, the first violation we see is simply not having a written hazard communication program. Sometimes people think, I've got safety data sheets, I've done some training, but they don't realize when they get inspected, you must have a written hazard communication plan. And let me just tell you briefly just what that needs to be. But first of all, the hazard communication, regulation. This is basically the regulation that says, look, you're working with potentially hazardous chemicals. So you need to have access to safety data sheets for those chemicals. You need to have labeling. You need to have personal protective equipment available. You need to have a way to train employees. And this all needs to be written down in the form of a safety training manual on hazard communication. So hazard communication, sometimes people call this the right to know law. Basically, it says you get to know what you work with. You get to know how to protect yourself. You get to know what to do in the event of an emergency. So this all needs to be outlined in your written plan. For example, having a hazardous chemical inventory, making sure that you have the safety data sheet for each product, making sure any unlabeled containers are labeled, making sure that new employee is trained as part of the onboarding process, and that all employees are trained at least once a year. So these are all the things that they look for in every inspection. And of course, a chemical inventory list, a list of everything that you have in your facility. I always say the easiest way to do this is just to get a list, query your distributor, what you've purchased in the last year, transfer this to a Excel spreadsheet or a Word document, and now you've got it year after year, easy to add or subtract a couple things. People also get into trouble with labeling. They don't realize that, yes, you don't need to put a lot of labels on things because most things are in their original container. But as soon as you transfer something to an unlabeled container, like you see here, you not only need to have a label on it, employees need to know how to read this label. So you might ask, what's hazardous? A lot of times people miss this too. They don't realize that almost every powder, liquid, and paste and found in your office, so every disinfectant, every cleaner, your restorative materials, your impression materials, these all come under the hazard communication standard. So make sure that you have these GHS compliant labels. Make sure that people understand how to read them. It's really important, and those are questions that in the event of an inspection, these inspectors will talk to individual employees and make sure they know how to find a safety data sheet. They know how to read a label. They know how to understand these pictograms. What do these pictograms mean on the labels? Which is why we're a real fan of having a quality written plan. And I always say, either write one or buy one, but have one, because you're going to get asked to, or the OSHA inspector is going to ask you to review that written OSHA compliance program. Now, safety data sheets. This is another, probably is about the #2 violation that we've seen. Again, it doesn't matter if it's in, well, we've been involved in inspections in almost all 50 states over the years. We've been involved in inspections in U.S. territories like U.S. Virgin Islands, Guam, Puerto Rico. It's always the same. They expect you to have a safety data sheet for every product in the office. Also keep in mind that many times we find people have the old MSDS sheet, material safety data sheet. That won't fly. That's really obsolete at this point, because the safety data sheet tells you what's hazardous in there. What do you do in an emergency? How do you take care of a chemical spill? So one thing I'm going to say regarding OSHA in general, and particularly when it comes to SDS documentation, make sure you put somebody in charge in your office. Somebody's got to be in charge of OSHA compliance. I would highly recommend that you make it a trusted or organized clinical employee. So a hygienist or an assistant, somebody who knows that back office. If we were talking HIPAA, which is a whole different webinar, there I would say you should have a management type person, somebody from the front desk who understands the business office. For safety data sheets, again, whoever's responsible needs to realize these need to either be in a binder like this in alphabetical order, or they need to be downloaded onto a hard drive that lives in your office, okay? What you can't say is, oh, my safety data sheets, if we have an emergency, we simply go online. to the 3M or GC website and we find our safety data sheet. That won't fly. For one reason, or for one thing, what if there's a power failure? What if the web is down? You've got to have a way to get to these things in an emergency. Now, another very simple violation that you see, and by the way, you're going to see what I go over today. These are simple violations. The OSHA's not out to trick you. These are simple, basic things. And one of the top ones we see here is simply not having an eye wash, or even more often, you've got an eye wash, but it's not functioning, it's not being inspected, because most people do have an eye wash like this, but they don't realize, first of all, you have to have it within 10 seconds, that's walking quickly, of a chemical hazard. So that's about 55 feet. That means in most of your offices, you only need one. You may need two. Take a look and make sure they're within 55 foot of every operatory or laboratory. Also, you might not know that these things need to be inspected every week. And you might be thinking to yourself, well, wow, that's going to take a lot of time. I'm talking in 30 seconds. Whoever's in charge of OSHA goes up, turns on the water, pulls the button, lets it run 20 seconds, done. Because if you don't do that, first of all, it's an automatic violation. It needs to be recorded that you're doing this every week. Secondly, on a practical note, if you're not testing an eye wash like this, it won't work. Bacteria will grow, biofilms will form. You go to use the eye wash, either it doesn't work or brown sludge comes out of it. So make sure you're documenting this. Simple things that can keep you out of trouble. Another extremely common violation that we see that people just simply miss is not offering employees the hepatitis B vaccine, or not having this signed declination form that for those that don't want the vaccine. Simple thing that OSHA always looks at in an inspection. Just to give you a little background, why does OSHA take it really seriously? Because of things like hepatitis B. Hepatitis B can lead to liver damage. It can be fatal. It can live outside the body in your dental unit for a week. Very transmissible, over 100 times more transmissible than HIV. The key thing is that immunization is available. It's recommended. Why? Because it's a dread disease that can't be cured. So make sure that everybody has been offered that immunization. And by the way, when I say a declination form, most people you're going to run into are going to say, oh, I've already had the hepatitis B immunization. I had it 10 years ago, 12 years ago, so I don't want another one. No problem. But they either need to give you a copy of their vaccination certificate or a copy of the declination form. One or the other has got to be in the record. And as this says, it's got to be offered at no cost. The declination form needs to be signed. And at a later date, if they want to get the hepatitis B vaccine, it's perfectly within their right. People often wonder about booster doses. Just so you know, there's no booster dose needed. It's not recommended by the US Department of Public Health at this time. Unlike, say, a COVID vaccine, it's incredibly effective and gives a long-term immunity. Now, this declination, this is actually a quote. This is the wording that needs to be in your declination form. So make sure you have a quality written program that has this language in the declination form. And Bill, am I right? If they needed to get this language, this webinar is going to be posted afterwards, so they could easily access this if need be. Am I correct?
Absolutely. Yeah, the recording will be available on our website as well as on our YouTube channel. And tomorrow we will also send out an email with a link directly to the recording.
Great. Good to hear that. Now, here's one that when I do webinars, and I often take polls, if I'm doing an annual training webinar, which is, say, a 3-hour webinar, doing an annual training seminar. And I asked the question of the audience, how many of you are providing baseline TB testing for employees? And usually I get about in that 18 to 20%. And this is something that OSHA works for because they know about 80% of people aren't doing it. So just a little background. First of all, TB isn't a bloodborne disease, it's an airborne disease, but it's a disease that can cause many problems for people. It's spread when, much like COVID, right, from coughing, speaking, laughing, or sneezing. So it's inhaled, it sets up shop in the lungs, and at that point, either somebody has a latent TB infection or actually TB disease. And the difference is, if somebody has TB, latent TB, they have bacteria in their lungs, but those bacteria aren't actively reproducing. That person is not infectious. So they could be treated in the dental office, or they could work in a dental office. Where TB disease, they're very, very infectious. Bacteria actively reproducing. The problem is if you don't test, you don't know. The good news in dentistry, and I think this next slide shows it, or the slide after, will show the fact that we are in a low risk situation. We really only need to provide a baseline TB test, one and done. We also, as part of the training that we have, everybody needs to know what to look for in any respiratory disease. Typical symptoms like fever and night sweats and chronic cough, coughing up blood and mucus. So this all needs to be in that training program. Just to let you know, dental offices are considered low risk, meaning it's unlikely that we would be treating TB patients. Not impossible, but unlikely. That means, again, we only need to have that baseline TB test, a one-time and done test. And just so you know, a test like that should only be in that $25 to $40 range. I would suggest you formulate a relationship with a local occupational medicine clinic. Occupational medicine clinic, they're efficient, they're low cost, they know how to deal with post-exposure problems if somebody had a needle stick or a scalpel blade cut in the dental office. So they can go in there, that new employee, get this TB baseline test. You have a copy of it in the employee record, and now they're done. As opposed to if we all worked in a hospital where we're likely to see TB patients, there we need to have not only the baseline TB test, but an annual test as well. And just keep in mind, why does OSHA look at this with such importance? Well, we can't safely treat TB patients in our office. We would have to have negative air pressure rooms. We'd have to have HEPA filtration of the air, UV irradiation of the air. So everyone needs to know when someone comes in that office, they're suspicious, you get a mask on them, you don't treat them, move them away from others, and make sure they're cleared before you would treat them. And this is something that we list as violation number 6. Clearly, it's in the top 10 that we see, not providing required employee training. So let's just go over a little bit about what the requirements are. First of all, it's required for all employees by law. But, don't forget, as Bill and I were talking about earlier, we were talking about OSHA compliance. And as I said to him, some people just find this to really be a bother, having to be in OSHA compliance. We've all got so many other things to worry about. But you know what? This is a big liability thing for your business. Whether you believe in safety or not, you've got to get your offices in compliance because there's some tremendous liability here. Remember that we need to train annually. It needs to be part of the onboarding process for all new employees. We can't just bring somebody on, that new dental assistant, and say, well, we'll train them next month. Or we have an OSHA webinar coming up in 3 months. We'll train them then. It needs to be part of that onboarding process. Another area where I see people get into trouble. And don't forget the training records. Many times there's no good record of training. A training record needs to show the date the session occurred, what were the contents, who conducted it, what was the name of the trainee. And remember to keep these records for 5 years after the date of training. This is very impressive to OSHA and an inspection when they come in and see that you have these training records, which is why I'm going to say most of you need some type of very robust training program where you have, say, an online program that you can plug that new employee into immediately, because it's not always convenient if you're just trying to book a webinar every year, right? How are you going to get everybody on the same one? Also, your training records, make sure you have an individual certificate of training for each person. Very important. That, in my opinion, based on all the inspections I've been involved with, very important to have some third-party verification of training. Another top violation that we see: failure to provide post-exposure treatment and counseling. Somebody gets a needle stick, somebody gets a scalpel blade cut, somebody gets a splash of blood to the eyes, and they're not treated properly afterwards. And you know, employees know about this. Nothing makes them more angry than when they have an exposure incident and somebody says, well, I don't think we have to worry about that patient. Their health history looks good. Just wash with some soap and water and we'll be fine. Remember, post-exposure evaluation must be provided at no cost to the employee anytime there's an exposure incident. And most employees are aware of this, because proper post-exposure wound care, of course, notifying the supervisor, notifying whoever's in charge of OSHA, simply washing the area with soap and water. If a nose or mouth, small mucous membrane is splashed, flush that with water. If your eyes have been splashed, then it's time to use that Eyewash. And don't forget this written incident report. We're talking about really a form. I really consider it 3 forms. One for the exposed employee, one for the patient to whom the employee was exposed, and another one that we fill out to send to the occupational medicine clinic for post-exposure treatment. So we're talking about things that talk about how did it happen, who did it happen to, description of just how that accident occurred. So again, I really implore you to have these papers ready to go. We always recommend pulling right out of our compliance manual the 3 forms, along with a map, phone number, contact person at the occupational medicine clinic, staple it together, have that post-exposure package ready to go. And talk about reducing liability for a business. Employees understand that they may have an exposure incident, and they'll look on it very positively when you have these forms ready to go. But they get very angry when nobody wants to help them or doesn't know how to help them after an exposure incident. What's a typical post-exposure follow-up going to be like? They're going to do a rapid hepatitis B, hepatitis C, and HIV test for the patient and for the worker whom they were exposed to. You know, of course, they're going to collect blood to do that. They'll offer post-exposure prophylaxis. Maybe it's giving a immune globulin injection. Maybe it's just counseling. They're going to talk about following them up for any reported illnesses over the next 6 months. Again, have these things ready to go. That's going to keep you out of trouble. Now, also, when you get this follow-up from the occupational medicine clinic, make sure that this is put in that patient or the employee medical record. We need to have it in there that they've been informed of the results, that they've been informed of any medical conditions that require further treatment. In other words, if we do this right, we can wash our hands of it. We send it to the occupational medicine clinic, but it's required that we keep these records in order. Another key thing, much like hazard communication, I mentioned not having a written hazard communication plan. Another top violation we see is not having a written exposure control plan. Just so you know how the language works here. The written program for hazard communication is the written exposure control plan, or the written hazard communication plan. For bloodborne pathogens, it's called a written exposure control plan. So you can see now we have to have two written plans, one for bloodbornes, one for chemicals, okay? So we've got to have it written, it's got to be accessible to employees, and of course, it's designed to make the workplace safer. So make sure you have this ready to go. Once again, I'm going to say either write one or buy one, but have one. Because you have to have in your plan things like identifying the hazards you have, the tasks that you have that could expose employees, what type of PPE you use, how employees get training if they need it, particularly that new employee. Also, things that you might take for granted, like the standard precautions you use to protect employees, the different products, engineering controls is another word for safety products that you use. What sort of housekeeping do you do? What disinfectant are you using, right? How often do you do it? How do people get the hepatitis B immunization? What do they do if they do get that needle stick? How do they get that post-exposure evaluation? So you can see all these things need to be in the written form. And it's called a written exposure control plan. Standard precautions, of course, everybody needs to understand. And OSHA expects everybody to understand fully that we treat everybody the same, whether we suspect them of IV drug abuse or they're the local minister or rabbi, okay? We do things the same for everybody. And I realize for you, most of the folks on this call, you're in multiple or facilities that have multiple sites. You may have 5, 10, 20, 50, 100 locations. And for you, I will tell you, it's really got to be consistent. I would really implore you to get consistency so every office has the same type of training, the same written program, all the same safety protocols. Now, when it comes to engineering controls, here's another violation that we see often. People don't realize that once a year, it's required that as a team, we talk about available safety controls, engineering controls. In other words, what things could we get in the way of safer sharps devices to make this office safer? We need to talk about it as a team. We need to document it in the exposure control plan. And this might only be a couple sentences. It may be that you're not implementing anything new, that you're already doing all the right things, but it needs to be discussed. It needs to be in your written plan. It's something OSHA will always look for, and which is why we actually leave blank spaces in our plan for that. Every year, January, February, there's a safety meeting. You need to document that you're considering these safer medical devices. Another thing that OSHA looks for, simple thing, is a written housekeeping schedule. Now, you could be doing everything right. Proper cleaning, proper disinfection, proper sterilization. But if these protocols aren't written down in the form of a housekeeping schedule, that can be a violation. I'm talking about something simple like this. What things do you do after each procedure? What things do you only do once a day or weekly or monthly? What product do you use? Who does it? Without this, you'll find that people start being inconsistent. Office 1 uses barrier covers. Office 2 disinfects. Office 3, they disinfect, but they use a different product. It's all about getting consistency. OSHA is really about safety. And one thing I should mention to you too, there's a lot of confusion about just what OSHA is. OSHA doesn't care about our patients. Keep that in mind. People will call our technical support lines, the compliance training partners, and say a common question, is this an OSHA approved disinfectant? Or is this autoclave approved by OSHA? OSHA would say, well, we're not in the business of approving disinfectants. We're going to say, whatever one you choose. Have you had training on how to use it? Do you have a safety data sheet for it? In other words, OSHA is all about employee safety, not patient safety. One thing they are concerned about, of course, is regulated waste, because as employees, you can be exposed to regulated waste. It needs to be handled properly. Now, before we talk about regulated waste, let's just remember that non-regulated waste, that's 90% of what we create. Non-regulated waste, that's just regular trash. Throw it out in a black bag, goes out in the dumpster, it's done. You're done with it. Where regulated waste, that has specific disposal requirements, and everybody needs to understand that. Not doing so is a violation and something that OSHA looks for all the time. For example, sharps. We all know we have to have sharps containers. And look, you're all buying from quality, reputable distributors. So believe me, your sharps container is closable and puncture resistant, leak proof, and color coded. That's not a problem. But what you need to make sure is you have one in every room. So you are eliminating sharps right at that point at which they're generated, not carrying it through the office, back to central sterilization, putting it into one large sharps container, because now I always say you're carrying a loaded gun through the office. Get rid of that sharp right there in the room. And that will not only make it safer, it'll keep you out of harm's way with OSHA. Just get to the next slide here. Now, PPE can be another area where people can get into trouble. We all know PPE, personal protective equipment, needs to be provided by the employer, but it needs to be available in proper sizes. It needs to fit properly, but it needs to be removed before we leave the work area. And where we will see people get into trouble is they're wearing, say, short sleeve scrubs from home. They come into the office, they work all day, they go home. Okay, you can't do that. That would be considered, you must have some type of personal protective clothing that you leave at the office, that's laundered in the office or picked up by a laundry service in the office. In fact, let me just go back on that, because I know there's always questions about that. You could do what we always did. Long sleeve scrubs, scrub pants, leave them in the office, laundered at the office. If you want to wear short sleeve scrubs to and from your house, that's fine, but you need to be wearing a long sleeve, waist length, or knee length, I should say, lab coat over it that's left at the office. Something has got to be left at the office to be laundered. You can't just be wearing clothes to and from work and laundering them at home. This is an automatic OSHA violation. Now, the things we've talked about so far, which are clearly some of the most common violations, probably make up about 70% of what we see. In other words, things that are either hazard communication, which is chemical safety, or bloodborne pathogens, which of course have to do with things like exposure control plan and disinfection and sharps containers. But don't forget, there are these other areas, I guess lesser known areas, that OSHA expects us to be providing protection to employees. Things like non-ionizing radiation, like you probably didn't realize a curing light or an electrosurge is considered non-ionizing radiation. Or what about electrical safety, or of course ionizing radiation for x-rays, means of egress. So let's just go over a couple things that I see here. First of all, egress. You're going to want to make sure that you have proper signage up. Non-ionizing radiation, it's required that you're providing shields for your curing lights, for example. And I'm just hitting some highlights here. Personal protective equipment we talked about. First aid. First aid, that covers the Eyewash. It also covers having a first aid kit available for employees. Fire safety. People know where the fire extinguisher is and how to use it. So there's a number of things that we need to do to really be in compliance, not just bloodborne pathogens and hazard communication. And Bill, I wonder if you could put up for me that OSHA audit checklist. It's something that we're sending to every attendee, but I just wanted to show them how we could use this tool. Now, this is something, this OSHA audit checklist, that I suggest you do as soon as possible and that you do it once a year. Sign these, date these, keep these long term. And you can see this goes over hazard communication, bloodborne pathogens, and things like general housekeeping. And some of the things we just talked about that we don't have time to go into today, like electrical and first aid and compressed gases, record keeping. We're also going to send you a link to our OSHA audit app. It is the most downloaded safety app in dentistry. It just puts this into app form. I think it's probably an easier way to do it. But any way you look at it, do this once a year. Also, Bill, if you wouldn't mind putting up for a moment the infection control audit app, or the infection control audit checklist. We've also included this for you, which again, this wasn't an infection control course today. I'm just telling you really what top violations are. But I do want to encourage you to do this infection control audit. Are you practicing proper respiratory hygiene? Are you wearing the proper protective clothing and laundering them properly? Hand washing, sharp safety. You know, to me, this is a lot like taking off in an airplane. Even an experienced pilot always goes through that checklist before they take off. And you're going to want to do this. And I will tell you, not only is it a very practical thing, but is it ever impressive to OSHA should you have an inspection. Which brings up the next slide. If you would mind putting that up, Bill, that I believe my next slide, I actually start to go into OSHA inspections. Now, I say this again, having been involved in so many of these over the years, knowing what OSHA is looking for, and I'm here to tell you that OSHA actually is quite fair and quite reasonable. I find them to be extremely reasonable, but they do expect you to do the things I've talked about today and the things that are on the checklist. They're not out to get you. They're not out to trick you. And let me talk about just how I see almost every inspection goes. First of all, they're going to come in, show their identification. They're going to want to see your written document. So they're going to want to say, where is that written hazard communication plan that we just talked about? They're going to want to see your safety data sheet binder. Maybe you have one like I showed you in the picture in alphabetical order, hard copies. Maybe you have it downloaded onto a dedicated laptop. Either would suffice. They're then going to say, let's see your written exposure control plan for bloodborne pathogens. And they're going to want to see your training records. And that's where I think it's extremely important to have a certificate of training with third-party verification. What doesn't really fly in inspections is if you just do a quick in-house training session, have everybody sign a training log. That really doesn't prove a lot. I'd like to see a certificate that describes what was covered, that requires a post-test afterwards so that the employee shows some understanding of this. This will protect you in an inspection. Next, OSHA is going to, after they look at these papers, they're going to pretty quickly know what kind of office this is, right? If you don't have any of these things, or all you've got is a couple SDS sheets and that's it, right away they know there's a problem. If they see your paperwork's in order, the rest of the inspection is going to go so much better because they're going to go around, look for the posted documents we talk about, like the OSHA poster, is it up? They're going to interview employees. And again, don't let that be intimidating. They're not out to get you. They just want to know, okay, dental assistant, dental hygienist, doctor, do you know where the safety data sheets are? Do you know how to get to your written exposure control plan? Do you know where your Eyewash is? I mean, they're just asking the basic things to see, in fact, that somebody just didn't rubber stamp training, that somebody actually received some training. They'll walk around, they'll make some notes, and Typically, they won't say a lot. They'll report back usually in a few weeks. It could even be as much as a month, but they'll send the results. Now, there could be a citation. If there is a citation, I would not suggest that you just take it. Unless you've absolutely done nothing, you've got a great chance of fighting this. That's one of the things that Compliance Training Partners does. We help you post-inspection dealing with the citations. Many times it was just a mistake made by the OSHA inspector. Maybe they were young, maybe they were inexperienced. I will give you an example. We just completed an inspection or helping a client who got a $21,000 fine. They're in the West Coast. We were able to get it reduced down to $3,000. But to me, what's more important, okay, probably $21,000 isn't going to bankrupt any office that you have. But what's more important is that you get OSHA off your back. Yes, it was really nice to save them $17,000, but it was even better knowing that they were in compliance, that OSHA checked all the boxes, and they won't be back to visit them again. That's what you need. So take these citations seriously, get some help in addressing them, but go through that audit checklist, and I can just about assure you, you won't even get a citation. Next slide. Now, people ask me about CDC guidelines, and sometimes people don't take CDC guidelines as seriously because they're called guidelines. I've had many offices, many managers who said, look, I'm more worried about OSHA. OSHA has inspectors. It's a federal law. CDC guidelines are just that, but don't forget, OSHA can enforce CDC guidelines. State dental boards can enforce CDC guidelines. Your public health department expects you to follow them. So you better figure that you've got to follow CDC guidelines as well, which is why I've included that audit checklist for you. So again, as I mentioned, so important to conduct an audit of your facility. I see no other way to really know where you're in compliance. I think it's going to take you probably about an hour to do it. And again, anytime you have a no, in that left-hand margin, write the date it's abated. Date these audits, keep them. Again, very impressive when you do have an inspection and the OSHA inspectors see that this is what you're doing every year. And they see not only that you do them, but you know your mistakes and the dates in which you've alleviated those problems. As I told Bill, part of our relationship here is that we don't disappear into the ether, as I say with our webinars. We have a team of OSHA-approved trainers who are glad to help you. If you come up with a question, in fact, we're going to have probably about 15 minutes here to answer some questions, but any questions that come up, certainly contact us. We can be contacted either at email, we can provide text service. I think it's best probably to call the 888 number and actually talk to a live person. But we're glad to help you with your compliance questions, your compliance needs. As I move on to the last couple slides here, I want to thank everybody for attending, taking this hour out in a busy schedule to do this. And you can imagine, I've been doing this for over 25 years. Safety means a lot to me, and I really appreciate that you want to establish a culture of safety in your office. Before I answer questions, let me mention that to get CE, you would simply go to compliancetrainingpartners.com. Again, you'll have this slide sent to you, but you would click on Redeem Access Code. At that point, you're either going to log in if you have a CTP account or set one up. You take a short post-test, print a certificate. But this is good for one live CE. I'd really encourage you to do that. With that, Bill, are there some questions that I can answer?
Yeah, there sure are. There were 3 that came in while you were speaking. One is if you download SDS and you have a power failure, you won't be able to access the SDS either. So do you recommend printing them out, or what do you think in a situation like that?
Here's my suggestion. First of all, I'm a real fan of having them either in a binder like you saw, good old-fashioned paper solution, or everybody's got an old laptop around somewhere, or buy an inexpensive laptop. A laptop, by definition, has a battery in it. I would have a dedicated laptop. It's not password protected. It's not hard to get into. You literally have folder on that laptop. In it are your safety data sheets in alphabetical order. Now, whether there's a power failure, whether there's an internet failure, you have full access to your safety data sheets. That's how I would recommend doing it. Either option A, paper, option B on a laptop.
Excellent. Somebody said they were late coming on. Could you please provide the first 4 violations at the end of the webinar? We will be providing the entire recording, so you'll have access to that. And you can jump through, and if you'd like, you can stop on those first 4 violations. But yeah, we will make sure that we provide that. Let's see, the recording will be up by the end of today on our YouTube channel. And definitely tomorrow we'll send an email out to everybody with a link to that. Are there any recommendations in the event of a temporary water outage? What requirements from an OSHA perspective should be in place for hand washing and bathroom access for employees?
Well, of course, when there's a water problem, that's when we're all glad that probably 90% of us, we have our self-contained water bottles on our dental unit. So we're okay there, right? We're in good shape there in terms of the 3-way syringe, the high speed. So the question then becomes hand washing. What I would do, of course, alcohol hand rubs are a good solution, but there are times when you do need access to soap and water. For example, if hands are visibly contaminated, or if you were doing surgery and you needed to do a surgical scrub. What would I do if it was a short-term water emergency? Again, bottled water, you've still got sinks, you've still got soap. Because you have self-contained water in your dental unit, you should be good for go. Now, of course, that would be a problem if you were out for a week or more. Then you might want to look at some type of temporary sink. But I would simply say bottles of water, disinfecting soap, you should be fine. I don't think you should have to shut down that facility.
Okay. That's great. Somebody here didn't receive the checklist. It's probably because you registered sometime today would be my guess. We sent them out yesterday. If you didn't, you can just email me, bill@groupdentistrynow.com, and I can send it out, or you can certainly email your team, right, Dr. Carpenter, and get it from you
Yes.
at that info@compliancetrainingpartners.com and request the checklist. Either way, email me or email Dr. Carpenter's team, and we'll get that over to you. Okay, those are the questions. Go ahead.
Bill, I was going to say one other suggestion too. Simply by going to compliancetrainingpartners.com, you'll see we actually have the audit checklist available there where you can do them electronically. Better yet, the OSHA audit app is listed on there, so you can just download the app. So that's another solution too.
Even
So
easier.
there's several ways to get those checklists.
Even easier. You'll get them for sure. Okay, some questions that we had that were sent in when people registered here. So I know you went over this, Dr. Carpenter. But you mentioned, you talked about TB. Is the testing required? This came up like 3 times. Is it, I know you said I thought I understood it as it depends, but you tell me, or is it definitely required?
It is. It is baseline TB. So one and done. Baseline TB testing would be required for all employees. And again, you should be able to find that at a local occupational medicine clinic for that $25 to $40 range. Not expensive, one time only. Definitely then have a record of that in that employee medical record that has been done.
Please tell the audience how long an organization has to complete OSHA training with new hires. And then the second part of that is, how would you handle temps?
I will tell you that for new hires, it needs to be, quote, part of the onboarding process. So before you start to send that new employee out there to scrub instruments, assist, clean their teeth, I would make sure that that training is part of the onboarding process, which is why, particularly for the audience I have here, I would really look at that Comply digital platform, that we have something where you've got access to unlimited training, because you've got new employees coming in on a pretty regular basis in many of the organizations you have. And unfortunately, I know it's tricky, but you've got to have that training right away. I really see digitizing that training as the way to go.
Any thoughts around dealing with people that are temps? We seem like there's more and more of them in the industry.
Yes, that is a good question. What do you do with that temporary employee that comes in? Now, I realize that they can't have access to full training. It's pretty hard to have a temporary employee come in for one day and they sit down and watch a 2-hour training session that's designed for once a year. I think it's very important that when they come in, there be an orientation session conducted, and it be documented. And that basically is, where is our PPE? Here, the fact that it's available. What do you do in the event of a needle stick? Should you have a problem? Our OSHA compliance manual with the written programs are here. Our Eyewash is here. Basic safety protocols, which would, to me, involve where is our Eyewash? Where's our manual? Who do I talk to if I have a question or a problem? Do you understand the use of PPE? Any questions? You need to have some familiarization. Technically, if you have a temporary come in and they're working for a temporary agency, that temporary agency is the employer, right? So the employer is the one who's actually responsible for training, not you. That being said, they're in your workplace. You want to show that you've done something to provide some safety training to them, even if it's basic in nature.
Okay. That's yeah, that's a great point wrapped around the temps. Okay, moving on. We've got a bunch of them here. What are the most common citations you see being issued?
The most common citations I see are, number one, not having written training program for OSHA, namely written hazard communication plan, written exposure control plan. The second, not having training of employees. So to me, the first things OSHA looks at, is there, and when I say an OSHA manual, I'm assuming we all understand that OSHA manual isn't just a couple safety data sheets. We're talking about a comprehensive OSHA manual, either paper or electronic, that covers all the things I talked about today. Hazard communication, bloodborne pathogens, but not forgetting the lesser subparts that I threw up on the screen there. Electrical, ventilation, noise, egress, things of that nature. So to me, number one, I'm an OSHA inspector. I walk in, I want to see, do they have written training programs? Number two, I want to see if they have training records. Number three, I want to see if they have safety data sheets. Right away, I can tell pretty quickly if this is a problematic office or not. And sure enough, those tend to be the top violations I see.
Follow up to that. What was the average fine for OSHA violations in 2023?
It's funny. It's all over the board. I guess if I had to say what is the average that I see, probably in that $7,000-8,000 range. Some of the highest we dealt with for the year were low six figures. Some of the lowest, a couple $1,000s. But one thing they all have in common, I will tell you what will cost you far more than that money. It's not the monetary amount. It's the fact that it creates an enormous upheaval in the office. First of all, by law, the written citation must be posted for all employees to see. Now everybody looks at it, and they give you right on there phone number to anonymously talk about, what do you see? Is this being corrected? Has it been corrected? This becomes water cooler talk for everybody. It just becomes a nightmare. The time that it takes to deal with this afterwards, talking to OSHA, dealing with all of this. To me, let's just take that inspection I just talked about, Bill, that one that was started out at $21,000. If that guy just had to write a check for $21,000, maybe that would have been the easy way out. He could go on. I'm not saying anybody wants to burn $21,000, but because we were able to make it go away, he didn't have to deal with all this fallout. So let's call it average $6,000-8,000 in a fine, far more cost in morale and problems that occur within the office afterwards.
Great point. How common are OSHA audits in the dental office?
Now, there's an interesting thing. Back when I first started, actually, when I first started, my company first started in OSHA compliance and dentistry, was actually in 1988 when we first became involved. Back in the early days, it was all about programmed inspections, in other words, random inspections. And I used to follow the statistics. Well, how many inspections occurred in Washtenaw County, Michigan? Now that's meaningless. All the inspections that we see, every one, is from an employee who contacts OSHA because they don't feel there's a culture of safety. So I'll give you an example of just to show you what I mean. This illustrates it well. 2 inspections I was involved with last year, one in US Virgin Islands. I mean, there's hardly anybody there. But an OSHA inspection occurred because somebody complained. Another one in a rural area on the Kenai Peninsula of Alaska, and not Africa, Alaska. Why? Because someone complained. So you can't really take comfort in looking and seeing, well, there weren't any OSHA violations in dentistry in my county in the last 6 months.
Good point. Okay, we've got about 3 minutes left, and I think we've got time for probably 1, maybe 2 more. And I had, like I said, I had a bunch of, I had 3 pages here. I got through most of 1 page. So we still have 2 pages of questions, but we've done pretty well. Like I said, we will get back to you. How can you get new team members up to par on training fast? So do you have any techniques for that? I'm sure you've got programs, but I think you alluded to it earlier. A lot of these groups have new members coming into the practices, so this is a constant occurrence. How do we get these people up to par as quickly as possible?
You know, one thing I'll encourage you to look at, we will send you information on the Comply platform, COMPLI, which was designed for DSOs and multi-sites, because I realize, as compared to the privately owned small dental office where maybe there's a hygienist who's been there for years who conducts the OSHA training, you've got more turnover. You've got a situation where you need consistency. So I would certainly encourage you to look at the Comply platform, where it's unlimited automated training with third-party verification. I think that's probably the easiest solution. Quite honestly, that's why we developed it, because we saw this need. It's difficult for all of you, isn't it, to try to run the practice and be conducting ongoing training.
Well, this is great. I think we are going to finish up with about 30 seconds left, because I don't think 30 seconds is going to help with any of the questions we have here. Great information. I'm glad we were able to get to a lot of those questions, though. I think those are some really, really good questions. We've got the compliance checklists that are going to come your way. You've got the app. You can go to compliancetrainingpartners.com. Any final thoughts, Dr. Carpenter? And thank you, by the way. This was great.
Glad to do it. And thanks everybody for attending. And if you do decide to call the technical services department, we actually have people that will actually answer the phone. I know that's unusual in this day and age, but we've got approved OSHA trainers who are glad to help you. So again, thanks everybody for taking the time to spend on this today. Hope to see you again.
Yep. Thank you, Dr. Carpenter. Thank you, everybody. And If you want access to the video, like I said, by the end of the day today, it'll be on our website, and we will send out an email tomorrow with a link to it so you can watch it. Until next time, I'm Bill Newman. This is the DSO Study Club. Have a great day.